Sensory Diseases Lecture. The objectives of this lecture are to identify major diseases, disease signs, symptoms, etiology, diagnosis, and treatments. Otitis media, which is one of the most common sensory disorders, is the inflammation of the middle ear. The etiology is the eustachian tube can become blocked or inflamed and trap fluid in the middle ear, causing infection. Inflammation or blockage can occur due to allergies, infection, common cold, allergies, enlarged adenoids, and exposure to cigarette smoke. Symptoms include fullness feeling, otolgia, hearing loss, vertigo, fever, chills, and nausea. The diagnosis is examination via the otoscope. Treatment can be analgesics, antibiotics if bacteria in nature, promote drainage, myringotomy, and tympanostomy. And as you can see here in the pictures, we have an eardrum that is a pinkish, bright, sometimes you'll see them bright red, and that means that they are infected. The normal tympanic membrane or eardrum should be a pearl gray in color. Here in the lower left-hand corner, we have an eardrum with a myringotomy or a tube put into it. And you'll see these little rings that allow the ear to drain so that fluid behind the eardrum can get out. Tubes will either be green, white, or blue in color when you look at the ear through an otoscope. Otitis externa is also called swimmer's ear, or is it the inflammation of the outer ear. The etiology is swimming in contaminated water, which can be bacterial or a fungal infection. You can also get otitis externa from wearing headphones. Symptoms include pain, fever, pruritus, and hearing loss, and may also drain clear or purulent fluid. Diagnosis is based on examination, and treatment is keeping ear clean and dry, analgesics and antibiotics if it's a bacterial infection, or an antifungal medication if it's a fungal infection. Impacted cerumen, also called earwax, is a soft yellowish-brown secretion produced by the external ear. Generally, these secretions are orangish yellowish-brown, but I have seen anywhere from green to black. Etiology is skin dryness, excessive hair in the ear canal, or a narrow ear canal. Symptoms are tinnitus, or ringing in the ears, hearing loss, or itching and pain. Diagnosis is an otologic exam, usually by an otoscope, in having a visual on the blockage. Treatment is an ear irrigation. Ruptured tympanic membrane is a perforated eardrum. As you can see here, there will be a hole in the eardrum. Etiology is trauma or increased pressure from fluid buildup. Symptoms are pain, partial loss of hearing, or drainage. Diagnosis is examination through an otoscope. And treatment is antibiotics and sometimes a surgical patch if it doesn't heal within an adequate period of time. Sometimes it can take up to 2 to 3 weeks to heal a perforated eardrum. Otosclerosis is characterized by a bony fixation of the small bones of the middle ear. This fixation prevents the bones from conducting vibrations from the eardrum to the inner ear, causing hearing loss. Etiology is unknown. Symptoms are slow hearing loss that tends to get worse over time. Diagnosis is usually an audiogram and an exam by otoscope. Treatment is a stapendectomy or a prosthesis replacement. And as you can see here in the picture, you can get bony growths at different points of the stapes. You can also get these bony growths on the incus and malleus, but the stapes is the most common. Sensorineural deafness. Type of deafness due to damage of the cochlea or the auditory nerve. Etiology is congenital or acquired through a stroke, tumor, or certain medications. Sometimes an infection or disease or trauma can cause this. Symptoms: gradual hearing loss. Diagnosis is audiometry. Treatment is hearing aids or cochlear implant if insurance will cover. Presbycusis is the progressive sensory hearing loss related to aging. Etiology is degenerative changes in organs of hearing. Symptoms are loss of hearing with high tones first and then gradually moving to lower tones. Mumbled or slurred speech can also be a symptom of this. Diagnosis is an audiogram and a history and physical to rule out other reasons for hearing loss. The most common treatment for presbycusis is hearing aids. Motion sickness is a nauseated feeling some individuals experience when traveling. The etiology is the abnormal movement of the organ of balance, or the semicircular canals, which are located in the inner ear. Symptoms are nausea, vomiting, diaphoresis, and vertigo. Diagnosis is history with description, and treatment can be medications such as meclizine, transgut patch, or Dramamine. Meniere's disease. The etiology is unknown. Predisposing factors such as infection or trauma are common etiologies linked. Symptoms include tinnitus, vertigo, progressive hearing loss, feeling of fullness in the ear. Acute attacks have nausea, vomiting, diaphoresis, and vertigo. Treatment: low-salt diet, diuretics, antihistamines, and the cessation of smoking are very important in preventing Meniere's disease.